because of this constant stimulation, there is a chance that sometimes things can go awry, and then afterwards you can have some abnormal cells growing, and then they grow uninhibited, rather than completely makes it very, very tight, and then afterwards cuts off the blood supply, cuts off the lymphatic supply. There's been a lot of work going on that, saying that wearing a very, very tight brassiere. So therefore there's been this no bra movement for people actually saying that when you're sleeping, remove the bra and sleep.
Sure.
An annual mammogram. Mammogram is X-ray of the breast, where you it just checks see whether there are any lumps, and if you see a particular pattern, then you're able to identify it.
I mean, how much time does it take for any women to understand that, okay, there is a slight change in my breast, I think there is a lump in my breast?
Sitting, like what we've been doing for the last 15-20 minutes, is also the next smoking. Not moving around is also the next smoking. It's as bad for your heart.
Doctor, today's generation tend to live in phone all the time actually. Does chronic stress or blue light from the screen leads to breast cancer? Welcome to Expert Podcast, where we simplify health with the help of top doctors. Did you know breast cancer is one of the common cancer among Indian women? Every year, more than 1.78 lakh women are diagnosed with breast cancer, and many of them are young. But the truth is, early detection can actually save lives. Today we have with us Dr. Rajiv Vijay Kumar, a senior medical oncologist from Gleneagles Hospital, Bangalore. Let's welcome him to the show. Doctor, we welcome you to the show. Thank you so much for joining us. It's truly an honor to have you with us.
Thank you, Nisarga. It's fantastic coming and being interviewed by you, and especially talking about a very, very important topic and something very close to my heart, cancer and breast cancer in particular.
We're more glad, sir. How are you doing today?
Fantastic. Having fun in life, taking care of patients, and well, I can't be blessed more in the sense that we do our stuff, get a lot of love from our patients, from their attenders, and then the science of oncology is growing so much that what was something like incurable in the past now seems to be something that is very, 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 very now controllable, and now we have the control in your hands. It's like earlier it used to be like you were being sitting in a bus at the back. Now you're sitting in the driver's seat. So therefore the control is better. We're able to take care of our patients better these days.
Very nice to know. Okay, doctor, before we dive deeper, let's start from the basics for someone who may not fully understand it. What exactly is cancer? Because the word cancer feels so scary and overwhelming for all of us. So what exactly is cancer?
So this is a very common question that many of them ask. I try to give different analogies. The common stuff that we would say is that, okay, you have abnormal cells growing, and then afterwards then those get overpopulated. Then it compromises the functions of the normal cells. So therefore the normal cells become smaller and smaller and smaller. It is like, for example, let's consider you have some abnormal passerbys who come into your house. You're like, okay, fine, come. You can please come and stay at home. Okay, fine, let me give you some food. And suddenly he brings his brother, his sister, and all of them, and they start reproducing. And then afterwards, you don't have enough resources for your own family and for yourself. And then afterwards, then they'll slowly push you out, and then they'll start asking you, why are you here? So it's something akin to that, like how we see, like something. This is exactly what some analogy that I could give. In these kind of scenarios, the cancer then afterwards overpopulates, then spreads to all over, goes to the neighbor's house, and then afterwards goes to the whole locality, and then ensures that that society, which was a thriving society, doesn't exist or live anymore. So this is some kind of an analogy.
What an explanation. Okay. And what exactly is mean by breast cancer?
So you see, breast is what, in the sense that it encompasses the skin, the lobules, and then the fat. It is, of course, natural organ for feeding the child to produce milk. Now, this is subject to large amount of hormonal variations, especially during every period that the lady has. There's so much of estrogen which is produced during the period that acts as, it also helps in developing the breast. At the same time, because of this constant stimulation, there is a chance that sometimes things can go awry, and then afterwards you can have some abnormal cells growing, and then they grow uninhibited. So the cancer of the breast is called the breast cancer. Again, here also you have stages. Like we have like 4 stages, like for most cancers that we all know. The first stage that you is evident is that the tumor is within that breast, and then the second stage is
I mean, that is how it actually starts in the body.
correct for almost every organ,
Okay.
apart from the blood related cancers like lymphomas, leukemias, and myelomas. Every other cancer, you have a stage 1, 2, 3, 4. It starts as a small aberration. Like I told you that the passerbys who come inside the house, only one or two fellows would come. Then he will start reproducing,
Starting to
start
look
growing.
like a minute kind of
It'll be
thing. and-
small, minute kind of stuff. So you it in the stage 1, it is well within that particular organ. Then it starts increasing in size. By stage 2 and stage 3, the size will have increased, and by stage 3, the lymph nodes. Like now, let's consider our a terrorist attack which occurs. So once you have a terrorist sitting inside the, let's he's attacked the main city, then afterwards you have all the security agencies all around. So then afterwards you will start trying to identify, and the security agencies have the CCTV cameras.
True.
So the CCTV cameras will capture where the terrorists have passed. So those are the lymph nodes. They are actually basically the strategically placed security systems inside our own body to capture these terrorists, that is the cancer cells. So therefore, what if those lymph nodes are involved? That means if the capture has occurred in the CCTV camera, that means to say that the disease has spread till there, or the terrorist has bypassed that particular area of the city. So you know that when we do staging, like we do a CT scan or a PET scan or whichever imaging modality, if the lymph nodes are involved, that means to say that the terrorists are not just inside that particular area, they've also gone till the periphery of that city. So therefore, there is a very high chance it could have gone to the rest of the body.
Oh,
So therefore, ladies and gentlemen, many times the question that comes to me is that, doctor, you've removed the breast, you removed the lymph nodes. There is no disease, no? I'll do PET scan, there's nothing there. Why should I take any further therapy? This is a common question that would come. For that, you will have those, even when you have a terrorist attack, you do a combing operation of the whole area.
yes.
So to ensure that even not one fellow sitting
Yes.
inside a pot or sitting inside a drainage or a gutter.
Yes, true.
The tumor cells are also like exactly like those terrorists. They would be sitting in small obscure areas which would not be visible to most of us, and which will not be picked up by any scan. So it's very imperative that we follow certain strict protocols while ensuring that good therapy is given.
Okay. And when we hear the word cancer, we just freeze and we get so overwhelming, we get so panic attacks and all. But what exactly makes the breast cancer so dangerous if it's left untreated?
The emotion part of it, actually, when you see, right, we know why it is actually a primitive emotion. In the years in the past, you would have seen, which is our first movie which we all saw, like, and thought of cancer, the film Anand. Rajesh Khanna and Amitabh Bachchan,
yeah.
where he will say he'll have Rajesh Khanna ji, he had lymphosarcoma of the intestine, where Amitabh Bachchan ji will take one X-ray and see one of the abdomen and say he's got lymphosarcoma. आपके पास सिर्फ 6 महीने हैं. So therefore, and most of you see, we are so influenced by movies. We are so influenced by the information that is fed to us. If the movies had said that, it's just cancer,
Yeah,
nothing
true,
da. It is just a cough and cold, and then most of it being like, yeah, cancer. इससे क्या होता है? It's just बड़ी बात नहीं है kind of stuff. But now, because it was being slowly we were influenced by all of these factors, and also when we saw our neighbors, known to people, suffer, and then afterwards have a miserable death in the earlier years. Naturally, that stigma stuck. That let me have any other disease, it's okay, but let me not have cancer. It's okay, heart attack, no problem. He will die. It doesn't matter. Road traffic accident, bad, but it's okay. But then afterwards, when it seems cancer, it's like someone's like skinned you alive, put some masala mirch on you, and then afterwards roasting you like a kebab or in a barbecue. So that's the kind of notion or the emotions that people actually undergo. So therefore, it's essential for us to get that stigma out.
True.
For many of my patients, they used to come in fearing, actually, like you said, right, that like they would come shivering. I'd be like, hello, is it AC too cold? And they'd be like, how mean of this guy. He's actually looking and talking to me. I'm like, okay, if I take a chill pill.
That is the thing with Indians, sir. We are so scared to go to the hospital, and if we get any symptoms, also we just sideways it. We don't want to dig deeper. We'll be like, chalo, it's fine. Let's stay for 2 days. It will go.
It's called the ostrich syndrome. You dig your head into the sand, the ostrich does that,
Yeah.
and thinks it's day, it's night. And then
Yeah.
after thinking that everything would become all right once they wake up in the morning. That's the
Yeah.
ostrich syndrome. So, but it's okay, not just for the Indians, it's world over. That was the situation. The rest of the world has woken up to it because, like in the Western world, it's all only single families. It's like
Mm-hmm.
only two husband wife. It's very very strongly nuclear families, like how it's happening in our cities. So therefore, what would happen is that if the lady of the house falls ill, there's no one else to take care. So
Mm.
therefore, she will take extra care about herself.
True, true.
It's happening now in India. Earlier, we would have patients coming to us with fungating large masses coming out from the breast. We seldom see those these days.
Mm.
The awareness has increased. Large number of women come to us within 2 3 days or even 2 3 weeks of
Mm.
identifying a breast lump. Many of them come. There's a small percentage, probably 5 to 10%, who come to us with a much more advanced disease. For them, mainly it is due to lack of access of medical care, or they choose not to come, or they say that okay, fine, if I go to the doctor, he will identify, he will do operation, he will do. What if he tells me if it is a cancer? I'll be like, so what if I tell you it is a cancer? It is cancer. We will treat it. That's
Very
it.
true.
So therefore, when I say that, it's important that you treat their fear with the same amount of energy and the gusto that they have. If you have the fear is such so high, you give them this amount of confidence. Say that
True.
it is, after all, it is just cancer. You don't have to worry about it. We are here. We will take care of it. You will do well.
Right. Every other health article or the blog says know the signs. But what exactly are the warning signs of the breast cancer?
See, like most articles you would have read, you would have found a lump in the breast
Hmm.
or some changes in the nipple or the areola. Areola is the area, the
Hmm.
dark colored, the circular thing around the nipple. Or if you can have some lumps in the armpits.
Hmm.
Or if you have some puckering of the skin. Puckering of the skin means it's like, suppose you have like a shrunken skin. It's like an orange type. We call it pure de orange. It's also called, it's a French word which we use. Skin gets puckered or it becomes firm. Or if one breast becomes bigger than the other. Sometimes you see that there are no particular lump, just the breast itself becomes much more heavier and bigger. So these would be the simple signs. And in a rare case, in a much more advanced case, you can have some discharge from the nipple, which could be either in the form of pus or in the form of blood. These kind of situations, then you need to immediately go and show the doctor, and then they would do certain set of tests like a mammogram, a sonography, and so on and so forth, and help identify this. So mostly these are the main signs which happens. People would mostly come and tell me, why didn't you come earlier? Sir, I didn't have any pain. Pain occurs when the tumor has rubbed into or eaten into the nerve, which is the pain sensitive structure. So if it has already eaten into the nerve, then it is already a little bit too late. So therefore, pain is not a major sign or symptom of breast cancer. The most common that you have is lumps or bumps or skin changes or change in the size of the breast, or one breast feels more heavier than the other, or any other. And if you look into the neck or into the armpits, if you find any lumps or bumps, then you need to take immediate action.
Okay, doctor. I mean, how much time does it take for any women to understand that, okay, there is a slight change in my breast? I think there is a lump in my breast. I mean, how much time does it take for any individual to just like identify there is something
There is
changed?
this particular set of philosophy that you answer a question with a question.
Hmm.
So in the sense that if you have to, if you
I
have,
got it.
if you have to know how whether you got your eyes are glowing or whether you got a small mole, what will you do? You have to keep checking it on a regular basis. When you look into the mirror,
Yeah.
just keep seeing, am I as beautiful as I was yesterday? Is everything all right? Oh, is my teeth, is it good? So we look at that, right? So then afterwards, okay, well, let's wear kajal, let's wear a nice bindi. So you take care of that, right? Although
True,
a lot
true.
of women who are like working very hard these days don't take good care of themselves, but it's very essential for you to take care of yourself. Like how you would look at your face in the mirror and then afterwards go through it. Similarly, you will have to go through every 2 weeks at least, or once in a month at least, while having bath. Look into the mirror,
Check your body
examine
parts.
yourself,
Yeah.
and what is the best time after completing the periods.
Hmm.
So for women who are menstruating, after completion of the periods, after the 3 days of periods, then using three fingers, it's called three finger technique. first in a rotatory motion around the nipple and the areola, and then the rest of the breast, and then over the armpits. You just need to just rub your fingers. And guess what? 65 to 70% of the lumps are caught by women who do self-breast examination.
Very
So we say that 5 minutes of your time for yourself. You need to invest in yourself, not just with meditation exercise. You need to invest in also in self-breast examination, because it's the most common
true.
cancer for women is the breast cancer. Second most is the cervical cancer. So this is very, very essential that women should do self-breast examination. The internet is loaded with large amount of animations to see as to what are the methodologies. So yeah.
Okay. And we spoke about periods. And we women undergo or experience different types of pain during periods, and breast pain is quite common.
Correct.
How do we know that which is normal and when to take things seriously?
So the breast pain would typically occur either during periods or during the 15th day. That is like the time of ovulation, that you can have even tummy pain or some amount of discharge at that point in time. So if those pains persist, then you need to take action and be cautious about
I mean,
it.
during the periods or
So during the periods, no. I'm saying that after the whole
after
plan
the
starts after
got
the
it.
evaluation starts after that. You need to be self-observant. If the pain has been there for quite some time, then you need to take action. Otherwise, if the periods wala pain, it comes and then goes away in between.
yeah,
So once it goes away, then afterwards, then you need to just keep it at the back of your mind that let me do a proper self-examination today. And if you're doubtful, go say hello to your doctor.
Okay. And what are the risk factors involved with these signs and symptoms? I mean, before we get diagnosed or before we consult the doctor.
See, the risk factors again. Most of the breast cancers are hormonal driven. Like I told you about, during every period, the breast is stimulated with estrogen. So what we have seen is that if there's a nulliparous woman, that means a lady who has not born children. So during the periods of pregnancy, the whole 9 months of pregnancy, and then after for 6 months or 1 year of when the mother is giving breast milk to the child, she's not having periods. When she's had 2 children or more, it's like that's 1.5 years into 1.5 years, almost 3 years she's not having periods. So the breast is not stimulated by that estrogen.
Oh.
So therefore that is protective. That's why they say when you breastfeed a children, it is protective, protects against cancer.
Yeah.
It's because the more when there's lactation, that is the mother is producing milk, she will not get her period also. It will get postponed also to a large extent. So hence, so that a lady who's not had born children, they are at almost 2.5 to 3 times at increased risk for developing breast cancer. And then obesity is a very, very important entity. So it's very essential now that we see that a lot of women are now so much into exercise, so much into Zumba, so much of the fitness industry. So because right now, what we see is that prevention is the best cure. So therefore, exercise, very, very essential. And then eating processed foods. Now you might ask, what is this processed food? The sauces, the jams, the powders,
Jams.
everything that is processed in a factory.
Okay.
If you turn the bottle and then you see it, you'll be like 100% natural fruit, and then you will see it'll be like 20 different chemicals put into it. Because and then let's consider the lemon juice that is available. When you have lemon juice, and then they say this is 100% lemon juice, no water added. Have you ever tried keeping lemon juice? We squeeze it and keep it in a container, and you use it 2 days later.
Yeah.
You will not be able to. Even if it's kept in the refrigerator, you won't be able to consume it. And imagine this is kept for 6 months to 1 year. Imagine the amount of chemicals that are gone into actually keep it to keep it alive. And then afterwards, milk. Now think about this. I'm sure that you see that there are sometimes when I was there in Delhi, I ended up having a milk packet outside. Went to hospital, came back, and then realized like, oh my God, it's gone. But okay, let me just try heating it. I warmed it, and it didn't go bad. I was initially very happy. Then I called up my dad and told him, you know what? I called up my dad and mom and said, oh, thankfully the milk didn't go bad. I was very happy when I came back at 8 o'clock in the night. They're like, you idiot. That milk didn't go bad. It means there's chemicals inside it.
Yeah.
If a good milk would go bad.
Yeah.
And you see those very very beautiful Instagrammable vegetables who look like, you just look at it and like, you're like, wow, kind of stuff.
Yeah.
There's not a single blemish, not a single turn this side that side. Everything is been loaded with a lot of chemicals. So what we eat, what we breathe, what we drink, what we sleep on, everything is filled with a lot of chemicals. The soil, that's why you see organic soil, they give it, you have to it should be chemical free for 10 years. For whenever you have to grow organic food, that soil should be chemical free for 10 years.
True.
So, because the chemicals have gotten so deep inside the soil, then into the plant, and then afterwards to preserve it, then to make it look more attractive to the consumer, that the sugars that we have, the white sugar, it's all processed. You can have good, or you can have your jaggery powder. It's which all our ancestors have been using for time immemorial. It's just that now we've gotten westernized. We start using this. All anything that is processed has and anything that has trans fat. Now you start looking, open the container, look for trans fat. Trans fat means it's like you have butter, and then you have some butter-like material which you put on your bread. This is all again hydrogenated oils which are put inside. And then even your so-called ice creams, which are not technically ice creams, you know that only a couple of companies make proper ice creams. Rest of them are frozen desserts. All of them have a large amount of trans fat.
So you do not suggest using dairy products with butter or jam
No,
also?
no. You use everything which is natural.
Uh-huh.
You need everything. You need to have. Many of them say, don't eat butter, don't eat ghee. There's all Western propaganda. Have a lot of desi ghee. And people will say like, they'll be like, let's have with olive oil. I've had with olive oil. Nothing will happen to me. I'll sauce my vegetables and it's good. I'm like, okay, fine. Whichever part of the world you belong from, use that oil where you were, where your ancestors came from. So
Sure.
imagine our humble coconut oil came as, oh, a very high chance of developing cancers and have cardiac problems. That came on American paper. After some time, now it's called the superfood. Now we have virgin coconut oil. I'm like, what is virgin coconut oil? I'm like, we've been drinking coconut oil for such a long time in avial and in so many of our dishes.
True.
But then afterwards, now it's 500 rupees for half liter. I'm like, for what? We get it at 75 rupees or 100 rupees per liter when we in our nearby pressery. So you see how it has changed. So oil is good. Desi ghee, very good. Ghee that you make at home, very good. Don't have these cut down on trans fats and any of the stuff, that food stuff that has on trans fats, please cut that down. So risk factors, you ask me, lack of exercise, obesity, very very important. Nulliparous, that is a lady who's not born children, they are at a higher risk. It doesn't mean that if you do, it's unfortunate if you not had children, or it's a personal choice, but I'm saying that apart from that, you can take care of yourself through these measures. If you do good exercise, good meditation, good sleep, very very essential. Now you'd ask me, how does good sleep and this have? Sleep cuts down the inflammatory markers. This large amount of inflammation that occurs all through the day when we are awake. So it's like then you put it on pause mode. You just go into chillax mode, sleep well. It's very essential to get down all of those markers down. If you don't sleep well, if you're not well rested, body starts off like it's like a engine is continuously running, and then afterwards it will wear out fast.
True.
When the parts wear out, the body yet continues to function, but it is those worn out parts start reproducing, worn out cells. Cancer starts.
Okay. And is breast cancer only about genes, or are there any everyday habits or the lifestyle that give rise to breast cancer?
Around 5 to 7% of breast cancers are hereditary. That is from grandmother to mother to the index case. That is any of us. Rest of them are sporadic. What is sporadic? It occurs, we don't know the particular reason. Of course, there is a gamut of all of these reasons. Right from the pollution, the chemicals that we consume through our nose, through our mouth, to water, food, everything. So these are all the particular risk factors which are actually causing the cancer. But around 5 to 8% of them are genetic. Rest of them are sporadic. So when you ask me what is genetic, so there is this BRCA gene. Of course, everyone knows Angelina Jolie. You know Angelina Jolie,
Yeah,
right? Of
yeah.
course. So most men, when we say Angelina Jolie, they're like, yeah, you get the sheepish smile on their face. Yes. So that's exactly what happens. The Angelina Jolie effect. It's thanks to her that she spoke about her mother and her grandmother who had ovarian cancer. She got herself tested. So in the year 2012 13, everyone started talking about breast cancer and BRCA gene, that is BRCA gene, and then hereditary cancers. So if not for her, most people would have kept it under covers. It was earlier that if you had a disease, you would not talk about it.
True.
It's a
Very
taboo.
true.
Thanks to people like Angelina Jolie. Thank you, Angelina. We all love you, not just for films, but for the fact that you were brave enough to come and talk to the world about this. So essential, and it is a landmark move that you did. Such a brave woman. She spoke about ovarian cancer and breast cancer. She got bilateral mastectomy done. Are you aware of that? She
No.
got both her breasts removed,
Haha, I got
and she
to know
got
that.
both her ovaries removed. She had completed her family, so we don't do that breast reduction surgery anymore. We do constant screening, every 6 monthly screening.
Hmm.
You're able to, you can identify the cancer even if it's small, and knock it off.
Okay. And to all of us hitting the gym, eating clean, having a proper sleep schedule and all, does living a healthy lifestyle reduce the risk of having a breast cancer?
Well, if you are a good, if you're fit, and then afterwards you fall down and you break a limb, are you
Hmm.
do you think you're gonna, you have high chances of you healing is better than a fat obese guy who's eating potato chips sitting on a couch?
Yeah, true.
You get it, right? So answering a question with a question.
Yeah, that's what I was actually
So
thinking.
it's basically, if you've done and had a disciplined life, if you've been doing your stuff right, if you've been clean,
Hmm.
no drugs, no
Hmm.
alcohol, no cigarettes, the chances of you developing cancer are less. And even if you do develop a cancer, the chances of you coping with it is far more superior.
Hmm.
You
True.
will you will easily win over it, because you are mentally you become a very strong and disciplined person. You'll be like, this is another small hiccup that I've got in my life. I'll handle
Ah,
this. Not a big deal. I'll find the right guy to get treated with, or the right lady to get treated with, and I'm good.
okay. You just you just mentioned alcohol consumption and smoking. Does alcohol and smoking has anything to do with the breast cancer?
Very much.
Like in
For
a percentage, if we
so
have to speak
we
about?
Okay. Now, are you sure that smoking causes lung cancer?
Hmm.
How do you know that?
Because it's written and
It's
also
some
we
a
have
lot of
seen the
data that
cases.
we've seen.
Yes.
So imagine in the 1960s and 1970s, doctors who were practicing medicine would, whenever they would take a photograph for a portrait, they would stand with their cuffs turned up,
Hmm.
with a white, crisp white gown and a white shirt and and a shining black shoe, with have a pipe, and then take the photographs. We didn't know that smoking caused cancer. It took a lot of almost 50 years of research for someone to hit the
Hmm.
nail on our head and say, hey, what you're doing, smoking causes cancer. Stop smoking. Similarly, till around, even when I was training in army hospital, till around 2013-14, we didn't have a direct implication of alcohol. Now the Surgeon General in Dr. Vivek Murthy in the US, he came out with a paper, white paper, saying that alcohol, even in small quantities,
Hmm.
causes cancer. We always knew that there was an indirect link, but now there is a proven direct link for alcohol to cause cancer. It is like adding ghee
Hmm.
to fire, or adding fuel to fire. When especially when you do both smoking as well as alcohol, it the number of carcinogens that are produced are like humongous.
Okay, but most of the people in today's generation, they go out, party, and they do maintain their gym lifestyle also. So, as you told, the percentage of them having it, but what overcoming it is very far but better than the people who are not maintaining their good lifestyle. Is it
Correct.
so?
Since that sitting, like what we've been doing for the last 15-20 minutes, is also the next smoking. Not moving around is also the next smoking.
True.
It's as bad for your heart. So if you are I think it's a balance of everything. See, when the Surgeon General mentioned that, everyone is like, oh, should I stop? There were so many memes all over saying that, oh, yeah, I've just looked at an alcohol, I'm going to get a cancer. There are so many people you can even argue saying that, oh, he's been drinking like a pig all through his life and nothing's happened to him. Look at him, he's like a gun. And look at this film, like in Munna Bhai MBBS you've seen when Akram says, मैंने एक बार भी दारू नहीं पिया, एक सिगरेट तक नहीं छुआ, एक लड़की तक नहीं छुई, मुझे क्यों stomach cancer आया doctor? And then afterwards Sanjay Dutt hugs him and says that, gives Jadoo ki Jappi and says that, I don't know, but I'll try to help you out however I can help you out. So we see both sides. But the only point that is there is, yes, we know that, we all know that smoking causes cancer. We know that alcohol is now the new villain in the picture. Combination of them both is terrible. Combination of them both along with obesity, lack of exercise is even more worse. But exact percentage we will get to know with time. But we just know that these are all, the goose is cooked if you have all of these risk factors.
Okay. And today's generation lives under constant stress. We worry about everything. We tend to stress over the simplest things. So, does living in a stressed environment or living a stressed life actually give rise to breast cancer?
It will give rise to every cancer, not just, you would probably die of heart attacks before cancer kills you. The amount of stress that most people actually take. It's this constant, incessant need to become better than your neighbor, better than your colleague, peer, to earn more. Why do you need that money? Why do you need that extra superfluous car or that extravagant car or that extra, you are just only two of you all and you want a 4 BHK, 5 BHK, one farmland. For what? Most of us end up buying a cow to drink a glass of milk. So,
Oh my God,
so
what
that's
a
exactly what most of us just do, in the sense that we don't need that much, but we start doing. Well, stress definitely has its own very, very strong role. Like I told you, we don't sleep well. There's a large amount of inflammatory markers. Stress naturally creates those inflammatory markers. All of them, if you just see, if you say a stressed person and a happy person is going to be far more healthier than a stressed person. Stressed person might probably be more good at his work in terms of getting the job done, being the CEO, doing this, doing that, and then getting all those accolades and other stuff. The happy person may not get all of that, but he's going to be a happy.
Yes.
He'll be like, eat well, sleep well, enjoy
Yeah.
life. That's what we are here for, to enjoy life.
True. Doctor, today's generation tend to live in phone all the time actually. Does chronic stress or blue light from the screen leads to breast cancer?
Well, we don't know. It may. It took us almost 50 years for us to pinpoint that smoking causes lung cancer.
True.
So therefore, sometime later, probably 10
Okay.
years, 15 years down the line, we may start realizing that, oh, does this using a cell phone may cause cancer, using a Bluetooth may not. This is a common question. Sir, can I use Bluetooth? Can I use Wi-Fi? So therefore, if you see, these are all non-ionizing radiations. Like you have a tower or a mobile tower on top of your house. It's mentioned over there. Non-ionizing radiation. Children and pregnant women stay away. So, the small, minute amount of radiations which keep coming out, keeping a cell phone and going through it is damaging to the brain. Leave
It's not
alone
just only
just
breast.
cancer, it's damaging to the brain. We become so numb-witted because unless you stimulate any kind of activity to the brain, should stimulate the brain. When you see, like when you just consume content, right, you're only just feeding information to the brain goes numb. If you see many times, even if someone actually snatches away your phone or switches
Yeah,
off
we
TV,
didn't get to know.
it takes after some time, then you start realizing that, oh, someone switched it off. So therefore, you see, most of us are wasting our precious lives looking into that. Apart from the philosophy, you're asking me a cancer point. We don't know right now. In the future, it may be. Well, right now it causes a lot of mental disturbance. It definitely does cause. Interpersonal relationships are completely damaged because of that. Of course, it leads to a large amount of stress. Anything that can cause stress, anything that can lead to increase in the inflammatory chemicals inside the body, can cause heart attack, can cause cancer.
We women live in shapewear and sportswear. I personally find so comfortable wearing a sports bras actually. So does wearing a tight bra can affect breast health or increase the chance of breast cancer?
Well, human beings were not naturally designed. Women were not designed to wear tight-fitting underwear and brassiere. since how since we've evolved. So anything that is too tight can be harmful. Well, it's good to probably wear that when you're playing a sport to avoid unnecessary embarrassment.
Mm.
Apart from that, a good fitting bra which gives good support rather than completely makes it very very tight and then afterwards cuts off the blood supply, cuts off the
Mm.
lymphatic supply. There's been a lot of work going on that, saying that wearing a very very tight brassiere. So therefore, there's been this no bra movement for people actually saying that when you're sleeping, remove the bra and sleep.
True.
So that ensure that there's natural, because that's how naturally we are
Yeah.
supposed to be.
Yeah.
If there's natural blood flow, natural air flow also goes on. It's very very essential that way. So I would be very skeptical, but I would say that because women are like now go-getters like you would want to are on the go all throughout the day, but it's important that you wear good supportive brassiere rather than wearing a very tight sports bra.
Okay. And this is for all the skincare lovers. Are the chemicals from deodorants, perfumes, or lotions something to worry about the breast cancer?
So there's a lot of work that has gone on, especially the deodorants which ladies wear on their armpits. Um, these can contain a large amount of chemicals called parabens, methyl
Mm.
parabens, sometimes even estrogens.
Mm.
Because why do we wear these? So that to smell good.
Yeah.
So, but uh, to ensure that you smell good and that you are attractive to the opposite sex, and for you to feel good about yourself, all of these are laden with chemicals. We don't have direct
Mm.
proof right now, but there's definitely indirect proof which definitely incriminates these, which may lead to cancer because you're applying it directly onto your skin.
True.
And armpits are very, very sensitive structures and they have very high absorptive capacity. When you apply these chemicals, naturally they would get absorbed. When you put your diclofenac gel or your move gel on your skin,
True.
you have good pain relief, right?
Yeah.
So imagine when you're putting chemicals inside and you don't even know what it contains, what can happen? So yeah, it doesn't mean that we go around stinking around, but I would say that good hygiene. So especially these 48-hour chemicals, these are going to block the pores.
Mm.
These 48-hour deodorants or
Mm.
72-hour deodorants which are there, they're going to block the pores, cut down on the sweating. Sweating is a natural mechanism for us to let out our toxins, to let out our
True.
fluids. So I don't think so that should be blocked. Good hygiene, regular care, regular washing is more important. And then you can probably wear natural perfumes like that. You get the organic perfumes like made out of rose petals or
Mm-hmm.
made out of different
Mm.
flowers. Those would be far more better than wearing
Than
these
this.
chemicals.
Okay. Here is the question we all should be asking. How do I do a breast self exam and from what age should I start doing it?
Like I mentioned, the self breast examination occurs after the day 3 of the period.
Hmm.
Uh, just so that because it's very hormone driven, so if you do it during your periods, you're going to find some lumps and bumps, and you're going to go cuckoo in the head.
Hmm.
So after 3 days of periods, you start doing with the 3 finger technique.
Hmm.
Go around in circular motions around the breast,
Hmm.
and like I mentioned earlier on, you need to do it at least once in a fortnight or once in a month. Every woman
Hmm.
should take 5 minutes off during her bath,
Hmm.
completely look at herself in the mirror, and then examine both sides of the breast, both armpits, and then necks as well.
That is how you do the screening in
The
front of
self
them.
breast examination. So when
Yeah.
you do the self breast examination, so just basically you do with 3 fingers, keep rotating, then you go from up to down and down to
Hmm.
up. Feel for any lumps, look into the
Hmm.
armpits, check for that, and then subsequently, if there is anything that you go to the doctor.
Hmm.
This is a girl should start this from the age of 20 itself because it's a myth that cancers occurs only in the elderly age group. It isn't. We see a lot of young women, especially even who have not yet been married. Also, some people we do see breast cancers in them as well.
Hmm.
So important that all girls after the age of 20, please ensure that women talk to your sisters, talk to your friends, girlfriends, your wives, to ensure that this self breast examination starts earlier on, immediately after 20 years of age. And after a woman reaches 40, that's somewhere close to the perimenopausal age, the incidence or the chances of developing cancer slightly a bit peak a little bit more.
Hmm.
After that, an annual mammogram. A mammogram is a X-ray of the breast where it just checks see whether there are any lumps, and if you see a particular pattern, then you're able to identify it. Now you have lot of our mammograms are now AI driven as well. So where we are using AI in oncology and in diagnostics, the a mammogram is fed into a machine, then using an AI tool, you're able to identify whether those calcifications which you're able to see may be suggestive of a cancer which is budding. So this is also called stage 0 cancer as well. So you're able to identify far before it is even visible to the or palpable to the hand, far before it's seen on an image. Using AI, you're able to identify this.
Okay. We have spoken about all the signs, symptoms, and what actually leads to breast cancer. Now, speaking of what are all the treatment options available for the breast cancer?
So the oncology or the study of cancer, you have three main branches. That is, you have removal of the breast through surgery. It's called surgical oncology. Then afterwards, giving chemotherapy,
Mm.
targeted therapy,
Mm.
hormonal therapy,
Mm.
immunotherapy.
Mm.
That's medical oncology. That's a guy like me who's post MD medicine or post DNB medicine, who's delving, only gives these potions, give these magical drugs. Then afterwards, you have someone gives the radiation. So the radiation is nothing but a huge machine which focuses X-ray beams and as a pinpoint, as a laser point, is given onto the tumor to kill the tumor cells. That is radiation oncology. These are the main branches that we have. So we need to use a mix and match of all of these to cure the cancers. So this treatment starts off with staging. We need to first stage the cancer. Once we know the stage, then afterwards you have appropriate therapies for each of those cancers. Like I mentioned, there is a stage 1, 2, 3 and 4. Stage 1 is a very small. In those situations, just probably a surgery itself is sufficient, so that you wouldn't need to even go into chemotherapy, or you might need to give radiation to prevent the rest of the breast from having a cancer coming back. You just give some amount of hormone therapy, that will also suffice if it's very, very minuscule. In the West, because there's so much of mammograms being done, they're able to identify it in this early stage when it's 0.5 centimeters, 0.8 centimeters. So therefore, there, the incidence is more. The number of women developing breast cancer per 1 lakh population is very high. It's somewhere close to around 30 to 35. In India, it is around between 6 to 8 or a maximum 10 per 1 lakh. But in India, we identified at a much more advanced stage. So therefore, most of our patients end up having all the three modalities. Whereas in the West, because of increased screening, they are able to identify it earlier. So you end up, cure rate is far more there, just because you're identifying it early. So that is in stage 1. In stage 2, there you will give a combination of little bit, you might need some amount of chemotherapy as well, then surgical removal, and then radiation as well. In stage 3 is the same thing. You'll give some chemotherapy up front, then do the surgery, then afterwards then you do the radiation, and then you'll follow it up with some hormone therapy if that subtype of the tumor merits so. If it's a stage 4, then you will generally not do surgery because it is already spread to other organs. There's no point in removing that breast unless it's fungating or if it's very painful. Then we don't operate unnecessarily. There we give our hormone therapies, chemotherapies to reduce, or targeted therapies to reduce the size of the tumor. And then the tumor becomes like a part of your, it's like a old, some relative, unwanted relative who's come and stayed in your house, doesn't choose to go out. So you give them food and ensure that they don't irritate you, or you carry on with your normal life.
Okay. I mean, how much longer does a woman having a 4-stage can survive?
So earlier, cancer was considered to be a death sentence, in saying that a stage 4 cancer, that woman would die and she would not be able to live beyond 6 months, 1 year. Now, many of our patients are living beyond 4 years, 5 years, 7 years, 8 years. We have our patients living up to even 10 years now, stage 4. Hormone therapy has made a huge difference. Multiple lines of therapies are there right now. So it's you have a first line, second line, third line. So it is like diabetes. You start with one tablet for diabetes, then it gets it's under control for some time. Then afterwards you lose control. Then you start another tablet or another combination of tablets. Then you take some insulin. Then you get some IV insulin, and then afterwards you come back to tablets. Then you use different modalities. Similarly, for even in oncology for breast cancers, you have so many different therapies which are there. You can give one or the other. Sometimes we give oral medicines. Sometimes we give IV injections, sometimes we get subcutaneous injections. I have a 83-year-old lady who's had a almost stage 4 breast cancer. She's just been only on this subcutaneous shot. She takes a subcutaneous shot once in 3 weeks. It's a 7-minute injection. She takes that.
7 minutes.
That's it. 7-minute injection. She comes. She comes. Hi doctor. Hi. How are you? I'll be like, oh, come, Aji. How are you? She lies down. Oh, you're gonna give me my injection now. Come on, go ahead. And then I'll be like, okay, fine, give it to her. And then she's like, you're done with. Okay, off I go. And then she goes. And then she's like, oh, you know what, doctor? It's come down to such a large extent. See, I'm like, wow, this is fantastic. So then this is the marvels of modern medicine. So therefore, despair not. There's so many therapies which have come. Someone might say, even your probably a very senior doctor might say that, hey, it's gone. The situation is gone. Like in Kannada we say, beat pidappa, yen madakagodilla. Something similar to that. Or like in Hindi we would say, chhod do, is aage kuch hone wala nahi hai. But it ain't so. There's so many therapies which have come that we are able to offer them to our patients, offer them the marvels of modern medicine, and they carry on to live a near normal life. And my patients are also now, recently my patient actually went to Annapurna base camp, ABC camp. She went all the way trekking. So they're all carrying on with their lives as though nothing has happened to them. It is just like diabetes or hypertension these days.
Okay. And any diagnosis or treatment is very painful for every individual and also for women. And we honor all our body parts, and breast is what actually makes us look so beautiful. And if there is any, like, how have you told, like, there would be a chance where you guys remove the breast because that would be the last chance. So, how emotional it is for a woman to live without the breast?
Losing even a finger also is so emotionally damaging.
True.
And to a woman, like you rightly mentioned, her essence of being a woman, her essence of being loved by herself, definitely there's a huge amount of role played by the breasts. So therefore, losing a breast, she feels less of a woman. Many of our patients, when we actually talk to them, they undergo a lot of emotional trauma that, oh, I'm going to lose my breast. It's like as though they're losing their own self.
True,
They
true,
feel that
true.
what is the point of living if I'm not half the woman that I was in the past. It's very important to say that it's just an organ, and there's so much of reconstruction that goes on right now, plastic surgery. You can take the mass, the fat and the muscles at the back. It's called latissimus dorsi. That's a muscle. It's like when you go to the gym, you get lats, they say, right? Lats. That's the latissimus dorsi. That is taken. It is again made in the form of a breast, stitched back, and they even tattoo the nipple around. So therefore, what happens is when the woman looks at herself in the mirror, she feels as beautiful, as energetic as before. And guess what? When they're doing this, to ensure that the other breast also matches along, she gets a tuck up of the other breast as well, and then she starts feeling 18 again.
How much does it cost to afford it?
See, that it all depends on where you're getting it done, how long. It can cost from around 80,000 to around even 5 lakhs, depending on where you get it done.
Okay. And how much does it cost to afford a breast cancer treatments?
It all depends on the
In
stage.
India.
It all depends. Thanks to the visionary medical services that we've had now, which was unthinkable around 10-15 years back, many patients who are below the poverty line are able to get free treatment right from diagnosis to therapy, to the full therapy. Like at least the roti kapda makan is taken care of. That they live a dignified life in many government hospitals, as well as wherever the Ayushman Bharat scheme has been thing. So it's important, ladies and gentlemen. Then you should talk, like if you should, the next community meeting that you'll have in your resident welfare association, in your club, in your kitty parties, you should talk about how you can avail the government services, what are all the hospitals which are affiliated with that, and how you can get your maid, your driver's wife, and all of them to enroll into this, to ensure that in case they do have a health problem, they can utilize all the government facilities free of cost, and then go on to live a normal life. So there it's completely free. And then afterwards, right from the surgeries would cost between 60,000 to around 1.5 to 2 lakhs, depending on the stays and where they want to do it. The chemotherapies can come as low as 10,000 rupees per cycle, and it can go on to you would typically give 6 to 8 cycles in these situations. It can, if you have targeted therapies, earlier it used to cost more than 1 lakh per therapy. Now it's available for even 20 to 30,000 as well in certain cases. So therefore, with advent of technology and India being the pharmacy of the world, we have a large amount of biosimilar drugs which are available, generic drugs which are available. And if you it is like taking the correct credit card. If you know how to use it, you
Yeah.
will be able to save money. If you know how to go to the correct doctor, to the correct situation, correct place, if you're not too much on glitz and glamour,
Hmm.
you'll be able to get your therapy done
True.
at a very, very affordable cost these days.
Okay. And can women still have children after the breast surgery?
Very much.
Yeah.
So
Okay.
there are certain chemotherapies which actually kill the
Hmm.
eggs, but we have certain other fertility preserving methodologies. So sometimes what we do is, when before initiating, we freeze the eggs, so that, or make it into an embryo and freeze it. So later on, when the lady, if she's unable
Ah.
to conceive
Uh-huh.
through natural means, then we are able to offer her her own egg, which
Oh.
for which she can actually become a mother again.
Okay. Is it a common procedure for all the women undergoing a
We
breast?
offer it
Okay. Okay.
whenever.
Okay.
If it's a lady, unmarried lady,
Uh-huh.
we definitely offer it and we counsel them. If it's a lady who's desirous of having baby, even though if she has one or two children, we offer it to them. So this is a common discussion that we have with all the women. We ask them, listen, this may affect your fertility, so if you choose to bear more children or start bearing children, this is what we would suggest. So we have a talk with our gynecologist and with a fertility specialist. They take the ova out, that is the egg, and then afterwards embryo is formed along with the husband's sperm. And if she's an unmarried lady, then the ova is stored. It's frozen and stored. It can be kept for even up to 15 years. The same concept which a lot of women in the West saying that they're too busy to get married, they get married at 35, 40. So they save their eggs at the age of 26, 27.
Hmm.
And then afterwards, then once they
Wow.
have the mind space to bear children, so either if they're unable to do it naturally, then they use their stored eggs.
Okay. And there's a common myth among women that only women after 50 are prone to breast cancer. Is it true?
Like I mentioned earlier on, we've been seeing even girls as young as 20
Hmm.
till very commonly, I say around 10% of my patients are less than 35. Around 60% of my patients are between 35 to 50 years.
Hmm.
And then the rest of them are women beyond that. So yeah, we do see a large number of them. And again, many of those, the women who are getting those early breast cancers or the earlier on in their life, they could all be genetic or hereditary breast cancers. Like I told you, the BRCA gene or the BRCA
Hmm.
gene,
True.
the Angelina Jolie effect.
Hmm.
So that.
Okay. Doctor, can you tell us one positive or impact case that you've seen in your career regarding a breast cancer?
What if I say that almost every case that I see
Oh my
is a
God.
positive case and something that impacts both the patient as well as me, to say surge forward and say that yes, this cancer is definitely conquerable. Almost, because every patient, I feel, it's not an anecdotal case. Every patient that we see is with the same bent of mind that by the Almighty's grace and by their physical prowess and their
Willpower.
willpower, and with the therapies, modern medicine
Hmm.
that is there to provide to them, they should do well. They should heal fast. So therefore, I almost see almost every patient that we see these days is with the same mindset, saying that you will do well. You have no other option but to do well. You will not look at failure as an option at all. You have done well all throughout life. You passed all your exams. This is a very big exam in your life. If you pass all of those exams, what big deal is this? You will pass this exam as well.
So mental strength plays a very
Huge,
important role.
very essential that people around. Imagine like you're a 10th standard student, your mother comes and says, yeah, what are you going to study? And then there's another mother who says that, you know what, come on, you can do it. You can do it. You're going to be the class topper. Even if not a topper, be your best. That is what matters. It's natural that the child who's surrounded by a positive environment is going to do
True.
well. Here too, the same. This is just another challenge in life. Be it a financial strike or it's a health problem, all of us need that positivity. Right from your treating doctor to the people around,
Mm.
everyone needs to be positive. That's when the patient becomes positive and says that, yes, I will
Yeah.
fight. So once they do that, it is like the the sense of achievement is far more superior than even climbing Mount Everest. That I have I have surmounted this particular
Yeah.
challenge. I have come top of the tops. Well, can I fail later? Tomorrow, kal ka dekha jayega.
Yeah.
Today, I am the winner. Today, I will win. Today, I will fight, and I'm not going to let go. So this is the attitude which we infuse into our patients, and this is the attitude that we actually make the whole. I don't only talk to the patient. I, after talk to the patient, infuse her with all the necessary energy. I talk to the family, because it'll be a crestfallen husband or the crestfallen father saying that please save my daughter no matter what. It's very important to energize them as well. We have a set of psycho-oncologists also who work on them, work on their fears, get rid of the fears, and say that, you know what, you need to be a fierce champion. It's because of you that your daughter, it's because of you that your mother, it's because of you that your wife is going to do well. Once we're able to infuse, the response rates are completely different. Not everyone's going to win all the time. Not everyone's going to be completely saved. But that whole effort that you put inside to ensure that you leave no stone unturned, not just with medicine, but with your own philosophy of positivity, infuse it to all the women around. I don't see any reason. So even if the eventuality occurs at some point in time, which it'll occur for all of us, they all come out with beaming, with their heads held high, saying that I did everything that was needed.
We achieved.
We achieved. I have not left any stone unturned. So therefore, when patients also come and say that, doctor, you've done everything that has to be done, we're very happy. And we've had a fantastic life. As and when the eventuality occurs, that is, till then, most of my patients, they all continue to live a very, very happy life, saying that I am a fighter. This is the best fight of my life. And if I have to go down, I will go down with all guns blazing.
Oh my God. We now get it that there are so many things that goes into patient's mind during this process. The diagnosis, the treatment, the mental health, and doctor putting out so much effort into her, making her mentally strong.
Absolutely.
And we have come to the last of the podcast. And what is the one piece of advice you want to give to young women about the breast cancer?
It's very essential to know about cancer so that you have no cancer. So
True.
it's very essential that knowledge is utmost. What we can ape from the West, which we most are right from the clothing to the foods that we eat, the lifestyle. One thing that I would say is that you need to take care of yourselves. You are the fulcrum. A woman is the fulcrum of most or every family. She could be a mother, she could be a sister, she could be a daughter, she could be a wife. She dons so many hats. It's very essential for all you women to take good care of yourselves. Like I mentioned, to make it into simple brass tacks, self-breast examination after the age of 20, a mammogram, regular mammogram after the age of 40, to ensure that even if there is a small lesion, identify it, kill it nip it in the bud. This is the service that you not just do for yourself, it is an obligation that you have for your family, because whether you like it or not, the whole family is dependent on you women.
True. Okay. It did not even feel like a podcast. It did feel like a heartwarming session with a friend of mine who is a doctor. That was an amazing session, and thank you so much for being so informative and enlightening us about the breast cancer. I think whoever is watching, Allah, they would be so enlightened and they would be like, oh, it is nothing because our doctor has said it. That was a very heartwarming session. We are so glad that you have joined us today. Thank you so much, Dr. Rajiv Vijay Kumar, sir. It was
Thank
a
you.
nice.
Thank you,
Sure, thank
Nisarga. Thank you for asking me the right questions.
Thank
And your eyes are welling up. Please don't cry.
No, I'm not.
Thank you, my viewers.
To everyone listening, if there is one thing you take away from this podcast, let it be this. Breast cancer isn't just something that happened to someone else. Start small, a self check, talking to a mom or a friend or a screening appointment. We have got one body. Let's take care of it. Catch you next time on the Expert Podcast, where health isn't complicated anymore. Namaste.